GE Healthcare offers proven, reliable, and non-invasive technology called Dexa to diagnose osteoporosis and fracture risk. Dexa stands for Dual Energy X-ray Absorptiometry. It is a measurement method that uses the difference in the absorption of high-energy and low-energy X-ray photons by different elements in a body to quantify the amount of bone, fat, and lean tissue in the body. This information can be used to determine the bone mineral density and the body composition of the scanned body. After a Dexa scan, the measured values are compared to a reference population at the sole discretion of the physician. The Dexa result provides a T-score and a Z-score of the BMD measure. A T-score provides the information about how different a patient's bone mineral density is from the average bone mineral density of a young adult reference population, whereas a Z-score provides the information about how different a patient's bone mineral density is from the average bone mineral density of an age-matched reference population. A Dexa scan is also one of the most reliable techniques to determine the body composition of a person. That is, the amount of fat tissue, lean tissue, and bone mass value, along with fat and lean tissue distribution within the body, which can be used by healthcare practitioners to treat metabolic disorders or develop exercise training regimen and dietary programs. In conclusion, a Dexa scan is a safe, non-invasive, and reliable technique to perform bone health and body composition analysis of our body and can help to protect ourselves from the risk of osteoporosis. Ask your clinician for more information about